In today's case study, under the topic of cardiovascular disorders, we're going to look at an example of somebody suffering from a deep vein thrombosis and how they would present clinically. Remember that deep vein refers to veins that are deeper within the body compared to superficial veins, and thrombosis refers to the formation of a clot. So this is a clot within a deep vein, and where this is commonly seen when it occurs is within the lower distal extremities. For short, oftentimes called a DVT. Now, how might this look clinically? In this example, a 39-year-old female presented to her practitioner with calf pain that had been lasting about a week. She is overweight. She works a sedentary job, meaning that she sits a lot throughout the day, and she reports to be a non-smoker. Now, when she was asked if she's on any medication, she had said no, but then later it came out that, well, she said that unless birth control pills count, and birth control pills are sometimes not really considered a medication by the patients that are taking them because they just take it as part of their routine to maybe prevent pregnancy and don't even think about it. Now, why is this important? Well, birth control pills contain hormones, and they increase the risk of blood clots because they cause the level of clotting factors or clotting proteins in the person's body to increase. And if you increase the amount of clotting factors, you're more likely to form a clot. And she reports having taken birth control pills for 20 years. More specifically, the calf pain that she's experiencing is on the right side. And upon physical examination, so it's obviously very important to look at the person's skin when they're complaining of pain, and that is something that doesn't always happen. But upon physical examination in this case, the calf, so the posterior part of the leg, is clearly red when you compare it to the left side. So comparison is also important, looking one side to the other where you should see symmetry, but if you see differences, it could indicate that there's an issue. Upon palpation, so the practitioner could take the back of their hand and place it on the person's calf in the area where they see that redness and have an idea of differences in temperature between the right and the left side. So it felt warm compared to the left side. Homan's test, this is an orthopedic test, was positive. Now, there is a video on the next slide that you can access to see how this is done, but this is also called a dorsiflexion test. And the action of dorsiflexion, you can maybe recall from anatomy, is where you would take your ankle and you'd bring your toe up, your big toe up towards you. That action is dorsiflexion, whereas planting your foot down to the ground and pointing your toes would be plantar flexion. So this is also called dorsiflexion test, and this physical test examination procedure can be used to potentially detect a deep vein thrombosis. So a positive Homan sign in the presence of other clinical signs and symptoms is a good indicator or a quick indicator of a DVT. I'm going to describe the test to you with words, but you can look at the video to see how it's performed. But try to picture this. In performing this test, the patient needs to actively extend their knee. And then once the knee is extended, the examiner is going to raise the patient's leg straight to about 10 degrees. And then passively and abruptly, the practitioner is going to dorsiflex the foot while squeezing the calf with the other hand. And so a positive sign would be that the patient reports deep calf pain and tenderness, and that could possibly indicate the presence of a DVT. And blood pressure is normal. Now, an important question here is, what is the potential complication of a DVT? So if you suspect that a patient has a DVT and you just send them home, or maybe you tell them they need to go to the emergency room and they don't, what can happen is that clot that's found within the deep vein can dislodge, or part of it can dislodge, and it can travel through the venous system. Remembering that venous blood is going to return to the heart, so it's like we're carrying this clot to the heart, to the right side of the heart, and then where does the right side of the heart pump blood? To the lungs. and it can pump that clot to the lungs where it can get lodged within lung tissue, causing a pulmonary embolism. Remembering that the term embolus refers to a traveling clot in this example. So please look at the video for your interest on Hohmann sign on the next slide, but also keeping in mind that just because somebody reports deep calf pain and tenderness doesn't necessarily indicate a DVT. You always have to have what we call a differential diagnosis of other conditions that could potentially also cause that pain. That's the end of today's lecture or mini case study lesson. Thanks for your time.